r/AskReddit. Doctors of Reddit, what is your worst case if I googled my symptoms? Serious answer. I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings. And try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says I think I have caught the Down syndrome. Or when a young woman thought she had testicular cancer. This confuses the fuck out of me. When I go to a doctor they specifically ask if I've done research about whatever. Like they expect it. Awkward position cause if I have researched I feel like an idiot using Dr. Google and having medical student syndrome. If I haven't researched I get the distinct impression nice disappointed the doc. Ever since we studied multiple sclerosis and neuro, I'm convinced I have it. Despite my only symptom being paresthesis, funny feels, in my legs at night. Not a doctor. But once back in 4th grade, during winter break, I had some sort of illness that made me throw up, sleepy all the time, and a few other symptoms I can't remember. So I was at my mom's computer, and I decided to Google my symptoms since my mom wasn't there. Turns out I had mono, or also referred to as the kissing disease. So after that, I was crying to my mom, hacking my guts out, while my mom tried to calm me down. And to this day, legend has it, I still don't know what I had. And I have never had it again. I am a gastroenterologist. I registered to write this. I once saw a 17-year-old kid with infrequent, mild heartburn. I suggest Tums. And he is now fine. His general practitioner, though, first thought it was caused by encephalitis and had ordered a spinal tap. When encephalitis came back negative, the doctor concluded that the pain is probably just in his head and prescribed him thorazine, a very serious drug typically prescribed to schizophrenics. I was elated when I was invited to appear as an expert witness in the malpractice trial. The doctor lost $180,000. Not a doctor but I deal with migraines. I would not be surprised if someone experienced a migraine for the first time, googled their symptoms while they still had the clarity to do so, and went to the ER thinking they are having a stroke. Not really related to this topic, but I am a medical student, and recently got sty in my eye. Sty is usually self-diagnosable but I called up my cousin who is a doctor just to confirm. Anyways, when I was telling this incident to one of my friends, he started scolding me saying as a medical professional, I should set the example of going to the doctor and getting proper medicines and treatment, and all I could say was, dude, I'm becoming a doc. I know how doctors are doctors, especially when they know you're a medical student, tend to overdiagnose or pretend as if we have medical student syndrome. But anyways, got the meds and my eyes healing. Midwife here. Or at least I will be in 2 months when I graduate. Google has its place. It helps people be more informed if you take what you read with a grain of salt and listen to your healthcare provider. I had a young lady last week who thought she might have preeclampsia because she'd googled it. And based on her symptoms she was absolutely right to come in. We were surprised when the tests came back negative. But she was also very anxious about getting it. So I was clear to her that she shouldn't go home and Google it more because it would just make her anxious. I also always try to give people appropriate websites to go to, so at least they can Google something evidence-based. At the hospital in my town there was a kid who came in saying he had knee pains. The doctor said it was from playing basketball, and 5 months later at a different hospital they found that he had knee cancer and it was too late to treat him. He died a few weeks later. Really sad story. Not a doctor but I spent 3 months in dread because I thought I had bad herpes on my face and groin. Turns out it was psoriasis. Kinda sucks sometimes but thank God it's not contagious. Paramedic student here. Last week we had a call for an imminent delivery. PT started having abdominal pain that would last a little bit and stop. And about 2-3 minutes later would start again. She googled her symptoms and everything she found was saying she was in labor. She called her husband and he told her to call 911. We walked in as the baby was crowning. She had no idea she was pregnant. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac, and when she was admitted, the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. I Googled a rash that my daughter had and I got it right. I always Google my symptoms and have only been wrong once. Sort of. I thought I had gastroparesis. I know that my stomach was not emptying. I could feel it. The DR said I couldn't have that because there is usually a reason to have that. And I didn't have any of those things. But I didn't care. He gave me a wonder pill that made me feel all better after 6 weeks of constant nausea and vomiting and being unable to eat. Long story short, I used to be in a relationship with a highly anxious hypochondriac. There were many spells of OMG I'm dying that were laughable. Things would calm down. Life was good. One time, for a handful of symptoms, headache, neck ache, general sick feeling, she mentioned I think I have meningitis. Normally, it was just the process of calming her down, etc etc. This time I thought, I'll Google that. Off things went. I bought into it. One long embarrassing call with the CDC later. There was nothing wrong. I figured they would know for sure. Beats me what I was thinking. Another expensive as hell trip to the doctor confirmed that nothing was wrong. That was embarrassing as hell. And about $200 in a wasted trip to urgent care. I had a grade school kid tell me he had a brain tumor. Turns out he put a dried bean in his ear and forgot about it. If you know how to do a proper search on the internet and discern bullshit from truth, you can actually get pretty far. I helped my doctor diagnose my issues by providing him the information I'd found from people similarly experiencing my condition. Without my searching, the doctor would have just sent me home with antibiotics. Again. One girl I shared freshman bio with told the professor she had a headache, and Google said girls with headaches might have breast cancer. Had the opposite experience with my general doctor. He was sure I just had social anxiety. Finally went to a psychiatrist at age 28. Diagnosed autism. Still, I felt like it probably was only social anxiety after years of my doctor denying it. Went to another psychiatrist. Autism again. Turns out my general doctor thought autism means can't understand metaphors and symbolism and Sheldon Cooper likeness. Not a doctor. But in the past I used to Google my symptoms. I was right once. For a problem with one of my teeth. Not the worst, but I found out I had VPH thanks to Google. Went to a gynecologist with my girlfriend so she could get tested, and indeed, it was. Thankfully it's not one of the cancerous types as we had also guessed, but it was scary nonetheless. Not a doctor, but one time I had some bubbles on my feet so I googled it and it did that if I didn't cure it I could die. 1 year has passed and hey, I'm alive. Cancer, turned out I had nothing. Actually I'm a doctor. But this story is from medical school. I had a patient who correctly diagnosed herself with mastitis. Although she was very worried that she had inflammatory carcinoma of the breasts. To be fair, they can look similar. Another time, I had a patient correctly diagnose a lump in her breast as a fibroadenoma. I was very impressed. Took my 92-year-old grandma to ER because it was Saturday. Told them I suspected UT. Doc didn't listen. Finally she had to go potty and they brought a potty chair in. After she was through, the nurse went to empty it. She took one look at how her urine looked and went out and almost made the doc write order for test. Of course it came back as UT. It can be difficult to diagnose a dementia patient because they lose ability to tell doc what's going on. They also become afraid of doctors because they think they will put them in a nursing home or such. Google didn't exist. But the internet did. I was positive my problems were caused from multiple sclerosis by my past symptoms and internet searches and medical books. This was back in early 90s. I was told the reason I couldn't walk on my leg was all in my head. It wasn't until 1994 when I lost my vision and had an MRI that the lesions were first discovered. Then I was told I had a demyelinating disorder and would probably have no other problems with it for the rest of my life. I researched demyelinating diseases and only 2 showed up: MS or Lou Gehrig's. I was terrified to say the least. Again. 2 years later I went numb from my chest to my feet on my right side and had electric shocks, El Hermit sign, when I bent my head down that I finally got diagnosed with multiple sclerosis. I am not a doctor, but I give prostate exams. I just came here to see how far I had to scroll before hitting the first "not a doctor." But it wasn't very far. But surprisingly, it wasn't the first response either. What do you call a doctor who got D's in medical school? Doctor. Fremulan, not a doctor. Not a doctor, but I went into urgent care for diabetic symptoms but got told to drink Gatorade to replenish my electrolytes and not diagnosed with anything. Months later I get neuropathy in my feet and Google the symptoms. Diabetes. Went in for a test at a different doctor. Got diagnosed with diabetes and told to lay off the Gatorade. I have reply notifications off, don't bother with your defense. I had schizophrenia with Google. Ebola. It's always Ebola. Not a doctor, but my aunt is, and one time someone came in said they had a sore throat and they looked it up and they came in scared BC they thought they had kidney cancer. Like, how TF do you get kidney cancer from sore throat? Not a doctor, but when my fiance said he was having chest pains and when he breathed, it crackled. I googled and all of the symptoms lead to serious illnesses such as collapsed lung. Thought nothing of it. Diagnosed it ourselves as an allergy and didn't go to a doctor till later in the day. It was in fact a fully deflated collapsed lung. I feel bad for my poor doctor. I've been diagnosed as a hypochondriac and he knows. Last year it got really bad after my mom died and I convinced myself that I was also dying. I visited him 5 times in 3 months. He was always polite but I could tell I was driving him crazy. Before my anxiety settled down, he flat out told me that I need therapy. I once thought I had mono for an entire year. Turns out I was just really bored. Wayne's World. I googled my symptoms. Turns out I have internet connection problems. Not a doctor, but I am currently in med school. When I was about 12 years old, I felt a painless lump inside my nipple. I thought this was something of low importance, so I continued to live my life. A few days later, when I was in the shower, I felt another painless lump inside my other nipple. I thought this was weird, so I decided to Google my symptoms. I thought about male breast cancer, and I knew it was a low chance of me having it. But I decided to look up some signs of the cancer. And there it was. In my exact words. Symptoms of breast cancer include a painless lump in the breast. I was terrified. I informed my parents. And I was in tears. I didn't know what my future would look like. And this thought shook me even more. Would I ever become a doctor? I then searched for treatments of breast cancer on Google. And it said the only treatment was to amputate the breast. I was even more torn. The next day my mom showed me an article about my breast cancer. And it turns out that I was just going through puberty. And this was completely normal. To this day, my family and I still laugh about the incident. Obligatory. Not a doctor, but I improperly diagnosed myself as having a possible heart attack. Why? I had experienced some severe back pain due to back spasms, but when it migrated to the front of my chest and felt difficult to breathe, I hightailed it to the ER. My BP was 200/110, and my BP is normally 115/80. They got me on heparin almost immediately. MRI stress test, and then determined that my heart was in great shape for a 50-plus-year-old guy. And B, my back is totally fucked. Got a nice shot of Valium which unseized my back from the spasms, and the pain in my back and chest went away. Now I have a script for Valium when I get severe spasms, which happen about once every few months. Some woman came in. Or it might have been a man. I never really got a clear view of them. They were complaining. Something about a headache or a neck ache. I was filling in paperwork and not really listening. I told them it was psychosomatic, as is almost always the case, but they could take ibuprofen if they wished to. Then they started telling me all this crap they had googled. Football injury, blood flowing from head, gaping head wound, brain visible through skull. I warned them not to self-diagnose or self-treat, and called in the nurse to take them away. 5 hours later, I was informed that the patient that had been to see me earlier was dead. Don't self-treat, folks. Leave it to the professionals. You don't know what you're doing and could do yourself a lot of harm. We don't go through med school for 5 years without learning a few things. I went to the doctor the other day because I self-diagnosed myself with HPV, cervical cancer, and bacterial vaginosis. I don't have any of these. Legit thought my clit was cancer. Not a doctor. When I talk to doctors I say Google told me blah blah blah. Is that accurate? Usually helps establish that I've tried to do research but trust them more than Google. Student nurse here picked up a shift in the emergency department as a healthcare assistant. Completed a tridge of a 19-year-old student on a Monday. Said she suffered abdo pain and vomiting the Sunday morning. I said what brought her in today. She said well Google said so. I was like okay. I told them. Nurse. She then proceeded to tell the nurse she vomiting after getting home from an hour after her night out. Didn't realize alcohol could make you vomit. Poor girl. A lifetime of drinking and she didn't really vomiting was a symptom of drinking. She had a lot to learn. I googled my symptoms and found out that I'm dead. I had a UT. Because I had the symptoms and googled it. Day of doctor appointment. It was just a regular checkup. But I asked for a UT test since I explained how I was feeling. Convo went like this. Could it be possible to request a UT testing? I've been feeling the symptoms of burning when I pee and some discomfort. How do you feel now? Any pain? Well no, not at the. Well if you did have a UT the symptoms wouldn't go away, you are fine. 2 or so days later I get a full-blown kidney infection from a. Who would have guessed? A UT. Sent out a complaint. Fuck that bitch doctor. I always ask for a test if I am suspicious of anything and I have them documented if they say no from now on. That was a horrible experience. Not a doctor. But I had a co-worker come into the office with this one. He was having nausea, fatigue, frequent urination and decided to WebMD that shit. We're chatting in the office one day and he says something like yeah. I've been feeling like shit lately. And it sounds like gestational diabetes but I can't find any cases of men getting it. I just slowly lowered my head into my hand and asked him, do you even know what gestational means? He did not. Not a doctor. But I got a cut on my eyeball when I was in high school. It healed up pretty quickly but then for a year afterward my cornea would feel like it was tearing while I was sleeping. Just excruciating pain. I did some googling and recurrent corneal erosion seemed likely, so I went to the doctor and mentioned this and told me it couldn't be that because eyeballs heal very quickly. So she sent me home with seasonal allergy eye drops and asked me to come back in 2 weeks. I came back and it was still happening and she asked me which eye it was and I told her and she accused me of lying about it because she claimed that last time I said it was the other eye. Just for your information, when your eyeball is tearing every morning you don't forget which one it is. So pretty much gave up on going to the doctor. Fast forward 3 years and it's still something that happened on a weekly basis. So I finally went to a different doctor and turns out I was correct about my self-diagnosis. This doctor even asked me if I was considering medical school. So yeah, I don't trust doctors. I googled my symptoms. Figured I had a pituitary tumor. Tried to convince everyone for months as the symptoms worsened and finally got a doctor to say okay. Fine. Get a blood test. Blood test came back. They said, yep. Most likely a tumor. Ordered an MRI. MRI confirmed. Then I had issues with urination and a feeling in the head of my penis when I did urinate similar to the sensation of your phone buzzing. I googled extensively and decided on prostatitis. The doctor said it can't be prostatitis, you're 24. I insisted. It was checked. It was prostatitis. It's not always good to google every headache, but if you know something is wrong and they don't feel like checking to see what it is, insist. I have an older brother and sister, and like most siblings we get competitive. About 8-10 years ago we were doing P90X and trying to outdo each other. A couple days later he was peeing brown urine and had pain near his thigh. He googled his symptoms and brought himself into the doctor and said something along the lines of, "I know I'm not a doctor and I shouldn't be googling my symptoms, but I think I have rhabdomyolysis." Turned out he was right, and it can be common with P90X, and apparently being close to a fireplace didn't help either. Not a doctor, but I used to study pathology back as freshman during my BME undergrad. I've learned not much, but sometimes I think of having TB or AIDS every time my immune system fails to cold or flu, because I clearly see the buildup. And this is just the same. Last time I totally freaked out and actually got an HIV test. I'm negative, but seeing acne, then extreme lack of energy, then cold. It just made sense. I realize my ridiculousness. So I try not to make a total joke of myself and shut the hell up while at doctor's appointment, giving away symptoms only, because these guys are stressed by themselves. Don't make them hate everything even more, please. They deserve being proud of their job, not facepalming and wondering if they made the right choice after yet another guy claiming he has a fucking meningitis in far north and symptoms being nausea and high fever. One time I discovered meningitis in myself, but then I've read little bit more and derived there is no way I could get that. Totally mental assumption. TLDR. I'm literate-ish, but not enough. So I drive myself nuts, but doc won't hate me because he knows better and I won't throw a pile of BS on him. I see why they don't like it. Yet occasionally you can do well. Find a great recommendation. Or even find out your doctor sucked. According to my research, I should have died because of Black Plague as a kid. I thought that I had problems with my puberty, but it was nothing special. It was a little later than usually. I've read that my voice may sound childish even when I will be 20 years old. And that there are men that don't hit puberty, but it's rare. Not a doctor, but I did stay at a Holiday Inn. Because I don't trust my own writing. I went to a doctor one time and he googled my question in front of me. Not a doctor, but my friend once said a guy came with a backache and wanted to get operated cause he thought he had kidney failure. Not a doctor, but I was having horrible debilitating headaches for a while. Googled my symptoms and they ranged from stress to brain cancer. Ended up being sinusitis. Not a doctor, but worked at a hospital for a while. One of our doctors came back to the nurses station laughing because someone was fully convinced they were diabetic because they were craving water, and Webb said that makes them diabetic. Turns out they are just human and require it to live. Thanks for watching, mate. Make sure to smash that star button for more high quality content.